Welcome back to our conference and to our next session, which is financial issues for people with thalassemia in a time of COVID. We have three speakers for this session. Our first speaker is Ralph Colasanti, who is a 57-year-old thalassemia patient transfused every 3 weeks with a BS in Computer Information Systems and Business Management. Ralph has been married to Carlene for what will be 28 years in August. They have two children, Jessica, 26, and Ryan, 17. And Ralph was blessed with a career in IT for over 30 years. This became challenging to hold down a full-time job due to early onset macular degeneration. So he was basically forced onto Social Security disability, going crazy from being the sole provider to a complete role reversal of Mr. Mom. He found himself not in the best financial situation. He soon found a career as a financial coach, studying how money works and obtaining his license in insurance and securities. It became his passion to help others by teaching them how money works, and he has been providing families with solid financial education for over 10 years. Our second speaker is Michelle Lahat, who is a licensed clinical social worker and has been working at Children's Hospital Los Angeles as a pediatric medical social worker lead in the hematology section within the Cancer and Blood Diseases Institute for 7 years. Particularly, Michelle has worked with patients with thalassemia, as well as many other rare, mostly genetic, blood disorders. As lead in the social work department at CHLA, Michelle provides clinical and administrative supervision for a group of other pediatric social workers serving other specialties throughout the hospital. And also speaking will be Danielle Massey, who is the social worker for the Comprehensive Thalassemia Center and General Hematology Program at Children's Hospital of Philadelphia. Danielle has been employed at CHOP for the past 17 years. She joined the Hematology Division 6 years ago, where she helped in the development of the Thalassemia Transition Program, guiding patients into adult care. Danielle has over 35 years of clinical and managerial experience in the field of social services, lending her talents and skills to various hospitals, maternal substance abuse programs, and programs for dual-diagnosed individuals in the southern New Jersey and Philadelphia areas. She is an adjunct professor at the Grand Canyon University and genuinely enjoys working with the students to increase their knowledge and understanding of the importance of community health services, especially with regards to diversity and inclusion. Danielle is the proud mother of 2 sons and her grandniece. Her favorite things include working with her church and reading. And I will turn things over to Ralph Colasanti. Ralph?
Thank you, Craig. Hi, everybody. This is kind of weird for me to be on a virtual conference with everybody, as it is, I'm sure, for all of you. I always look forward to this time of year when we could all get together and hang out as a group and, talk to all our fellow patients and basically all our family members. So when Craig reached out and asked me to speak about, COVID and the financial challenges that it is bringing on to people, I actually asked him first, should I talk about politics and then maybe religion? Because those are like the 3 things that you're told never talk about. And the problem we have with financial challenges is simple. It's a lack of education. Most of our financial education comes from our parents. It's the way we were brought up, the way we learned. They don't teach you in school how to balance a checkbook. Most people don't even balance a checkbook anymore. They just live off the app. They don't teach you in school how money works. They don't teach you the power of interest and everything else that goes with it. I have a BS in business. I took many financial classes, and my biggest education came about 10 years ago when I was looking for something to do, and I became a financial coach. And that's where I'm leading you now. The lack of accountability, that's another challenge. People aren't held accountable. They don't hold themselves accountable to their financial needs. So when you're going on a diet, you join Weight Watchers or one of those programs, you have some accountability. When you're training and you're working out in the gym, you have a trainer with you. You have some type of person. When you're playing Little League, you learn how to play baseball because of your coaches. So why not in the financial area? Why are we afraid to talk to people and to get some advice and get some counseling and get some coaching? The next part is the lack of a plan. And that's when I found out I didn't really have the plan in place that I thought I had. When I had a great career in IT, and all of a sudden it was taken away because I can't see the screen as well as I used to. And, there was a lot of different ins and outs of that. But I went to my plan that I thought I had in place through work, and I found out that my plan wasn't as good as I thought it was. And a lack of income. So that's when I realized I do have a lack of income, and I needed a way to figure out how to subsidize the Social Security. And that's when I found financial coaching. So like I said, we don't really learn about money, and we don't learn how money works. But what I've learned through working in this business is these things that I'm going to go over with real quickly. Obviously, Craig only gave me a few minutes. So normally when I sit down with someone, it takes about 45 minutes to go through all this. So I'm going to speed through it. But the theory of decreasing responsibility, that's something I didn't know or didn't learn. But quickly, it's basically when you're young and you're building your family and you have your children, your responsibility is all the way up here. I don't know if you can see my hand, but your income's kind of down here because you're just getting started in your career. So as your kids are growing and you're going up the line, your responsibilities are less. Your kids are out of college, they're on their own. Your income's hopefully gotten a little higher. So your responsibility is down here and your income's up here. We teach you how to handle that and how to plan for that. The rule of 72 also goes hand in hand with compound interest. Compound interest is like the biggest force in the universe, which nobody really teaches you how it works. Most of you understand this because of the thing on the bottom that we do is handle debt, because your credit cards are a vehicle for compound interest. But the rule of 72, real quick, if you take a number like 1% divided into 72, that tells you how many years it will take for your money to double. So if you're in a savings plan or a savings account at the bank and you're getting 1% interest, in 72 years, whatever you're putting in there should double. If you're getting 3%, in 72 years, actually it'll be 26 years that your money will double. It's a simple rule. So the high cost of starting late or high cost of waiting, that's what I found out that I did. I actually didn't have a plan. I had a plan in place, which I thought was a good plan, but I never had anybody really look at it. And when I sat down with someone to look at my plan and to see where I was going to go and how I was going to handle, being on Social Security with a family of, 4 that I was supporting, and handling the whole role reversal thing, we put some things in place that could sustain me. And that's when I learned to actually, when I started reading books about finance, Rich Dad, Poor Dad was one of them, where it said, pay yourself first. Luckily, I was doing that with my 401k. So I didn't have that much of an issue with paying myself first, because I actually was doing that and I learned that. But that's something I will teach you how to do. I did have some issues with debt because I was making good money, and we were living off of whatever we had, and credit cards were never a problem to pay off at the end of the month. So when that money stopped coming in, that became a problem. And the next thing was buy term and invest the difference, and that's more about protecting your income. So quickly, the power of compound interest. And as I mentioned this for you before, it's a powerful force. Now, in this example that I did for us, I took $200 a month, putting away $200 a month. That's $50 a week from the time you're 30 to the time you're 65. So that's a 35-year span. In a vehicle that gets you 3% interest, that's going to accumulate to about $149,000, $150,000. In a vehicle that gets you 6% interest, that's going to accumulate to almost $289,000. And in a vehicle that's going to get you 10% interest, that's well over $700,000. And you're saying, what's the difference here? The difference, there's really no difference. The difference, you're putting in the same amount of money. The difference is what vehicle you're putting your money into. Most of us are used to putting that money into a savings account, and we'll contribute to our 401ks. So there's other ways out there, and I could teach you those ways. I can't do it today. Obviously, I don't have enough time. But what I can do is teach you how we build your financial house. When I sit down with a client or any type of customer, first thing we do is put a foundation in place. And that's where we take care of our protecting your income, protecting your health. Now, I know it's challenging for most thalassemia patients to get some type of life insurance. So we are dependent on the type of life insurance that I would tell you not to depend on, and that's still kind of through work. But unfortunately, that's the only kind that we could get. I mean, there are other companies that may insure us and may not insure us, but I know it is a challenge. And HSA is basically a health savings account. I'm not a big proponent of HSAs. They do have their they do fit into some people's financial plans, but they don't fit for everybody, and I'll explain that. The next thing we want is a roof over our head. So we got a solid foundation. We put a roof over our head. So that's making sure we have a will in place, a living will, and a durable power of attorney. If something happens to you as a patient, as even parents, if you don't have a will in place, things aren't done the way you want them. If you're a parent and both parents, meet their demise and pass away, what happens to your kids if the will's not in place? Well, everybody's thought is, well, I'll just go to my mother or my siblings. That's not necessarily the case. What happens to your children at that point is up to the state to decide. And I will never leave the government to decide anything for my family. So that's really important thing, is to get a will in place. And, of course, know your wishes if you should meet with illness. The first thing we want to accomplish here is to put an emergency fund in place. And that's having like 3 to 6 months of expenses in a relatively safe account, so that, something like COVID pops up and you're out of work for 3 months, or you can't get to work for 6 months, you at least get to sustain your bill and your income and sustain the household. Now, I know it's challenging to put some of these things in place, but I'm going to tell you, one of the reasons why we have this challenge is because of debt. Now, educating you in debt is probably one of the favorite things I do, because it helped me a lot. Teaching people how to debt stack versus how to pay a little bit extra each month. But most people make that mistake. They'll pay an extra, they'll round up their bill, when if you concentrate on one form of debt at a time, it really, really helps you out and gets you out of debt very much sooner. And then, of course, the fourth thing on our house, to build our house the next story, is to have a plan to duplicate your paycheck when you retire. Now, when I was growing up, we didn't think about retiring as outpatients. Retirement was really far off, for us. And honestly, we didn't think we would live long enough to experience a retirement situation. So, my question to you is, do you currently have a plan in place to do these things? And I will tell you, 9 out of 10 people I sit down with do not. And that's where I come in to try to put this plan in place for you. And the problem is, and most people don't have this clear direction. Their money's going in all different directions, whether it's to your mortgage, to your car insurance, your credit card debt, your 401k that you're funding or you're not funding. It goes in many different directions, and many different people have a hand in those directions. Like, your mortgage guy isn't going to talk to your insurance guy and say, hey, can they afford this? They're just going to try to sell you the product that they want to sell you. So what I do is I put in a financial GPS, and this is what had helped me a lot over the last 10 years. And this is why I am passionate about this. And I actually, love sitting down and helping people. It's basically a GPS. It tells you how to get from point A to point B. Put your financial plan in place. If you can't save for an emergency fund, we're going to try to figure out, maybe one less Starbucks coffee a month will get you to save for that emergency fund. Different ways that we could, help you put the plan in place. But when we're done with this, it's a written plan. It's something you can look at every day, or like I look at it every day, but most people just look at it once in a while, and see where you're going and what, and the adjustments that you have to make along the way. Now you're saying, Ralph, you're a sweetheart. You do all these things for people and you don't get paid on it. Actually, you do make money. There is a way to make money, but you guys will never pay me. Okay? How I get paid is the same way a travel agent gets paid. When you book you remember when we used to be able to travel? Remember when that was like a thing? When we could, like, this is summer, we were planning on traveling somewhere. Most of you were planning on traveling to New Jersey to attend this conference. I remember those days. But so when you book those trips through Travelocity or your friendly neighborhood travel agent, you didn't pay any extra, you just paid for the trip. Well, the people you book through, that hotel and everybody else, paid Travelocity or paid, or paid the travel agent, what they call, I guess, a finder's fee or some type of fee. And that's basically the same way we work. If I put a plan in place for you and you decide to go with some of the vehicles I have to offer, then those companies will pay me a fee. And that's how I have been making extra income. And honestly, if we have these plans in place, the challenges of COVID and the finance, our financial challenges, we have health issues, and we have, many health challenges. And I know there's many doctor bills, but I don't want to tell the doctors on this thing because I know there's a lot of them, but that's always the one I pay last, because as long as I'm paying something towards them, they're not going to be affecting my credit or anything like that. So I hope this was informative. I hope you reach out to me if you need any help with this. There is a lot, obviously it's a lot more detailed than now, but I would like to hand it over to Michelle and Danielle. And I thank you for your time, and hopefully we'll talk soon. And Michelle and Danielle.
All right. Hi, everyone. Nice to talk to all of you. I'm zooming in from Los Angeles. So it's still morning here, so I'll say good morning and good afternoon. Thank you, Ralph, so much for everything that you just shared. I know that those are things that I don't pay enough attention to, and I'm sure a lot of people can get a lot out of talking to someone with your breadth of knowledge about all these things. So what I'm going to talk about today together with Danielle is some different resource ideas and different ways that people can find support through medical social workers. Both of us work in our respective hospitals with the thalassemia population, and we have been learning about people's struggles in general, and then especially the escalation of financial concerns due to jobs being shut down, due to stay-at-home orders, due to loss of work, or all kinds of benefits due to the COVID-19 virus. So what I want to start out with is a bit about health insurance. People who are losing their benefits due to job loss or hours being cut, things like that. Some people are going to have to purchase their own insurance due to under the Affordable Care Act. And this is a talk that I've given before at previous conferences, but one of the things that is really most important to look at with those plans is that there's different levels of care. There's different levels of, so in California, they call it Covered California. It has plans that are gold, bronze, silver, and some people purchase the plans based on what and people's medals are in the Olympics, that the gold must be the best plan or the silver is the kind of in between. And that's not necessarily the case. So try and ignore whatever terms are given to those plans. And as people who either have thalassemia or have children that they care for with thalassemia, it's important to pay attention to what the co-pays are going to be, what the out-of-pocket maximum is going to be, and what you're going to be able to afford to pay early on. Because what happens with people with chronic illness or chronic conditions that require frequent lab draws, that require potentially transfusions, drugs that are expensive, things like that, what happens is people reach that out-of-pocket maximum very early on, and they have to pay a lot of money that they might not have saved up all at once at the beginning. So if you pay attention to what those plans require of you financially from the beginning, you can make the best choice given how much you're going to be expected to pay each time you go for a transfusion, or each time you have a clinic visit, or each time you have a lab draw. So those are some ideas just to make sure that you're asking those questions and not just going based on what fancy names the different plans have that make it sound better or worse for you. Not all these plans obviously have people with chronic conditions like thalassemia in mind. And so what might be the gold for someone who has no health concerns and is just having the insurance for the annual appointments versus or an emergency situation versus someone who knows in advance that, you know, every few weeks there's going to be a big medical expense. So that's my advice to you regarding that. I think, Danielle, did you want to talk about COBRA?
So I was addressing actually the FMLA piece.
Right.
Hi, my name is Danielle, and I'm a social worker for the Comprehensive Thalassemia Program at the Children's Hospital, Philadelphia. First, I want to just say congratulations to Ralph for doing an awesome job. Ralph was one of my first patients in the hematology department. I'm so proud of him. With regards to FMLA, which is the Family Medical Leave Act, a lot of our patients during this COVID-19 time had either been laid off or their hours have been decreased. And based on what we know about COVID and the risk that it presents right now, we have to be mindful that some, especially in Pennsylvania, they actually are in the yellow zone, and they were supposed to be moving to the green zone, but they halted that. So at some point, some people thought they were going to be able to go back to work, and then found out that they weren't able to work. So a lot of parents or patients have been asking about the Family Medical Leave Act. And the Family Medical Leave Act entitles eligible employees to cover their employer, to be covered by their employers for 12 weeks out of the month, 12 weeks out of the year, without any interruption of their insurance plan or any other benefits they receive from their job. There's a form that you can get from your Human Resources Department or download offline and provide it to the social worker at the hospital, and they can fill it out according to the needs that are present with the patient or the family. Right now, it's and according to what the CDC is saying, and then the Thalassemia International Program Foundation is saying, we don't really have any severe restrictions on our patients, but we do have a couple of families that have parents who work in nursing homes or high-risk facilities for their employers, for their employment. So we have provided them with letters. But one thing we want to remember and to remind you is that once you start using your time, it can be used intermittently or 12-week stretch. But once you use your time is gone. So if you have a spouse, if you yourself have any kind of medical issues, if your child is in a hospital outside of going for transfusions and things, you might want to consider how you're actually going to utilize that Family Medical Leave Act, because once you're done your 12 weeks, you're done. And it doesn't mean that you're fired, but it means that your time is no longer protected by your employer. So if they decide, you're out too much, we can't afford to keep you, then they can do that. So you want to be mindful of that. One thing I wanted to address was regarding the schools. We've been getting a lot of calls and a lot of emails from parents regarding the school situation. And because of COVID-19, nobody knows what the school situation is going to be. Even now, with school supposedly to start in September, here in Pennsylvania, we've been doing online school for the past few months. And right now, they've been discussing plans about what they want to do in terms of splitting the day and having some children come earlier and then taking a break, and then some children come in the afternoon, because they won't be serving lunch or anything like that. But nothing is concrete. In June, there was a publication from the Thalassemia International Federation, which talked about different levels or groups regarding thalassemia patients. Group A are patients who are transfused but don't have any other comorbidities and didn't have a splenectomy. They've been actually given a green light through the Federation that they could return to school or to work without any other restrictions other than the basic guidelines for protection, social distancing, gloves, masks, those kind of things. In Group B, there are a group of patients who are at a greater risk. And if you get a chance to read the article, I know that Cooley's had sent out information regarding the article that you can, you have to have those restrictions if you have a person that works in a nursing home or another person that's constantly in contact with other people, then your guidelines are a little different. You have to be more cautious about what you do in terms of entering back into a regular regimen. And then the highest risk are our patients that's over 50 years old and have other issues with like high iron levels and a splenectomy and other things. And it's just recommended that you not return to work or to school until the pandemic is lifted altogether. So, you know, with anything else, of course, we want to encourage hand washing. We want to encourage you to wear masks. And if you don't have masks, some of the hospitals have been getting loads of masks from different people who've been home during the COVID season, sewing and blessing the facilities with these things. So if you don't have them, that's something that you could reach out to your social worker at your facility and get a hold of some masks. You want to have more than one, because when you wash the one, you want to be able to have another one on hand, and make sure that you wear your mask. The 504 plans, we will be on top of that once we have a better idea actually as to what the plan is going to be from the schools, and it's going to differ all around the world, so we can't give a generalized answer. The only thing we say that the Thalassemia International Federation has set up a set of guidelines for us to be able to use, which is very helpful to us. And with regards to resources, because a lot of people have lost their jobs entirely or have had their hours cut back, the federal government has provided various subsidies to help with regards to unemployment and the extra money you get with unemployment. Right now, people who are receiving unemployment get an extra $600 to help pay that. Different states have been giving benefits with regards to food stamps and other emergency cash assistance, and helping to pay utility bills through Lahat and other energy assistance programs. Check with your social worker to find out what is available to you. Here in Pennsylvania, we've been fortunate because we have something called PAF, which is the Pennsylvania Assistance Fund, and we have been able to help people with their bills and things like that. That program actually has a financial stipulation to it, but if you lost your job or your income has decreased, most likely you will meet the criteria financially to be able to receive this help. And that help can go to pay a mortgage, it can pay a car payment, it can buy clothes, whatever the deficit is that the family is facing, we can be able to help them. But you must live in Pennsylvania in order to get it, this particular one. But there may be other benefits in your country or your state, I'm sorry. So check with your social worker and your program regarding that. And then of course there are other programs in our tri-state area like Michael's Way, Fred's Footsteps, and then there's a program called Casey Cares, which is located in Maryland, but I'm pretty sure they service people all throughout the country. So they offer pajamas and entertainment stuff for the children. I know they've been sending a lot of gift cards to our patients and families along with pajamas, so you can have a movie night at home and things like that. Gift cards for pizza and gift cards for Walmart and things like that. So you want to check into some of those things. I know Kathleen has put together a list of resources that can be used. So I recommend that you get a hold of that and go through and see what you might be able to use at this time. I wish you all a safe time during this COVID season. Just remember to wash your hands and wear your mask. It's not fun, but it's important that everybody stays healthy. Thank you.
Yeah, I'd like to add, thank you for that. So again, to reiterate what Danielle said, is to please reach out to your local medical social workers. Not everyone meets with us all the time. It depends on what is going on or where you get your care, but there are people around who are very knowledgeable about what resources that are specific to your geographic location and what your eligibility might be. The other thing that I want to put a message out there for is for virtual or online mental health resources during this time. People with chronic illness always are at a higher susceptibility for things like anxiety and depression. And during this time where everyone in the world is at a higher susceptibility to anxiety and depression due to the fear, the tension of, not knowing what's going to happen, anxiety about getting sick, caring for loved ones, if you have your own underlying conditions, what that means for you and what you're able to do, fear for your how you're going to take care of your children and entertain them and educate them if that's not something that you used to be responsible for and now you are. Things like that are common. You're not alone if you're feeling any of that, and there are resources out there and they are online, so you don't have to jeopardize your feelings of need for social distancing or not leaving the house, because most of these resources have in fact moved online. So please take the time to look at things. I'm going to continue to send some things to Kathleen as well, so check back with Coolies and their list of resources that Danielle referred to. So we encourage you to look at that for financial resources, but also it's really important to talk to someone who can give you tools regularly to deal with any feelings of anxiety or depression, especially in this difficult time.
Great. Thank you all. Very, very good presentation. We are opening things up now for questions for Ralph, Michelle, and Danielle. And we have a few questions that have come in now. One for everyone or anyone that might know, have an answer for this. I'll summarize it a little bit. Are there any resources or support available for thalassemia patients or any college student, I guess, who feels that they are not getting a fair shake because their college is going to be offering only online classes but charging the same tuition and prices that they would be, is there any kind of resource or support that you would recommend for patients in that situation? Difficult question.
Yeah, this is Danielle. I haven't heard of any special programs. I know that the colleges and universities who have planned to operate online are supposedly still offering the same supports. It may be virtual if it's counseling. I mean, I don't know exactly what supports or you feel that you won't be getting as an online student versus being in class. So if you could be more specific, that would be helpful.
Yeah, I think that part of the problem is that people feel that paying tuition, which oftentimes includes high costs for things that you would normally get in person, like the campus community, or if it's food or things like that. I think that I wish there was something that was providing support to people in that situation. From what I've been gathering from watching the news and kind of following along with some of my own patients that I've been learning from with some of this, is that it's very based on the school and what they're deciding to do. If people are going to be coming back to campus, if the campus housing is going to be different based to allow for more social distancing and not overcrowded dorm rooms and things like that, versus keeping everything online, at least for the first semester, the fall semester. So I think it's very case by case with that. I haven't heard of any specific financial support for people who are now at home and have to pay the same high tuition.
But if you're doing at home online teaching, you should not be paying room and board, because you're not going to be living there, nor will you be eating there. So it should be a decrease in the amount of your tuition if you have been living on campus in that form. But for the actual classes, the cost is probably still going to be the same, because they still have to pay the professors to teach the classes, even though it's online.
And it's so school specific that, I mean, it depends on what school you're at. But as far as resources, it's if there's any type of scholarship or anything out there, it's never too late to go after them. So that's the only thing I would suggest, is to see if you could, look, search like crazy for scholarships. But like Danielle said, the cost of tuition is always the cost of tuition. College pretty much gets more expensive with room and board and meal plans and living on campus. So I don't know where we could help with that, but I'll be happy to see if I could find something.
Thank you. Ralph, the next question is for you. Do you recommend a person save and pay off debt slowly, or try to pay off all the debt first and then start saving?
That's a good question. Well, what I try to do is try to do a little bit of both. If you're paying your debt already, and we put that stacking in place, we will teach you how to pay your debt off quicker. And then it's obviously, if you're paying your debt and you don't have enough money to save, then we have to figure out, it's all individualized, but try to knock out the debt as quickly as possible. That's my number one thing when I sit down with someone. We try to knock out the debt. And as far as if you're not like contributing to a 401k or anything through your employer, then you need to definitely start something where you're paying yourself first. So I guess I didn't answer the question properly. There's no exact science to it until we sit down with you and we find, I find out exactly where you're at. But paying debt, if you have credit card debt, we got to tackle that right away, because that's where compound interest works against you. Totally.
Thank you. And also for Ralph, do you have any tips for patients that depend on Medicaid for insurance but want to make a financial savings plan?
Well, if there's income, yeah, I mean, having any type of savings plan is what we want to gear you towards. So it doesn't matter what your health insurance is. Like I'm right now on Medicare, and I'm only allowed to make so much money based on the the criteria with Social Security. So I do my savings, and pretty much because any type of money I make, I put into savings, so it's not showing up as like an income. There's ways we could help you around it.
Great, thank you. And a question for Danielle and Michelle. So if you go to a hospital where the social workers are not as expert as you are, and you don't feel that you're getting information that you need from them, and you find yourself really needing to kind of, you've lost your job and you're really kind of starting from ground zero with trying to figure out what to do financially, where would you go for resources, for information on everything that you basically need to know as someone who's newly unemployed?
I would say contact Kathleen Durst at Cooley's Anemia Foundation, and she can put you. We have a nurse social work committee, and she can put you in touch with someone that can help you get the information, or she can get the information and provide it back to you.
Yeah, and I would say also that local, even if at your specific hospital you don't have social workers that might be knowledgeable, there are definitely different social service organizations anywhere you are that you can kind of, thank goodness for Google. You can look online for who's local to you and see if there's a local DPSS, if there's a Department of Mental Health nearby, things like that, that you can look up to see if you have experts in that area on what social services are available. But absolutely, Kathleen knows myself and Danielle. That's how we were asked to speak at this. So we're in contact, and so we're happy to look into things, even if we're not in your geographic location. I'm happy to look into any referrals that I can help you with, whatever I can find out.
And I could jump in here just for a second and just say Kathleen is wonderful. So if you just reach out to Kathleen through the foundation, she has all these great women that are on my screen right here at her fingertips. So, and she actually was the one who helped me start, and then I found Danielle, and we just worked together. It's great.
Thank you. Another question for Danielle and Michelle. How do you negotiate with hospitals on bills which are part due because insurance isn't covering the treatment? Can we ask them to settle for a fraction of the amount?
So I know that it varies on the situation. It's very case by case. In some instances, if you're paying out of pocket, the best kept secret is usually hospitals are willing to negotiate if you're paying out of pocket for lower prices. So I know that that's something that is worth asking for if that's your situation. In terms of insurance not fully covering things and having high out-of-pocket costs to you, there are different copay support programs. A lot of times they come from the pharmaceuticals. So I know that my patients who are on JADNU, things like that, that they often can reach out to their pharmaceutical company and ask for some kind of copay assistance, and a lot of them have been able to get help that way. And additionally, some hospitals do have charitable funds that can help potentially to assist with different healthcare related issues. I know that we have in California, we have a program called CCS, which is a supplement to our Medicaid program that helps cover, it's supposed to cover all hematology related issues in conjunction with Medi-Cal, with their Medicaid. And so that's usually very helpful, and they have their own staff of caseworkers in that program. So different states might have different programs that can help with people with chronic conditions as well. And you just kind of have to ask and see what's out there, depending on where you are and what eligibility you might have. So there are programs that exist to help depending on the situation.
And in dealing directly with the hospital around bills, hospital billing is a whole nother world because it's broken down by doctor services and then departmental services and then labs. So you may be getting 3 different bills for one visit based upon who you saw during that time. But as both Michelle has stated and Ralph said, contact your hospital directly. And Ralph made a very important point. One thing is with hospitals is that if you're making a concerted effort to pay your bill, they're not going to report you to a credit agency. So your concerted effort is whatever it is that you can afford, be it $5 a month, $20 a month, make a payment and it won't be reported as a delinquent, or as something against your credit or anything like that. So you make a concerted effort. I mean, I know sometimes that these bills can be thousands of dollars, but once you start making a payment of doing a concerted effort to do that, you reach out to the financial department and say, I'm not able to pay. Maybe then they would negotiate with you a rate that is better. But if they don't give you a rate, if they're not willing to give you or aren't able to give you anything lower, just always make a payment of something toward that bill.
Yeah, and one more thing that I forgot to add, and I'm not sure if any of my patients are watching this. I have some parents who I've talked to a lot who've been billed incorrectly due to exactly what Danielle mentioned, which is that, even within the hospital, you could be getting bills from all these different departments that don't necessarily talk to each other. So there have been times where people's insurance hasn't been billed appropriately. They didn't just enter the right codes in or whatever the case might be. So I would always, if you feel like you're being billed inappropriately or getting sent to collections for fraudulently for no reason, I would always push back and make sure that they have your exact insurance information, that they didn't miss a number when they entered in your ID number from your insurance. Things like that do happen. There are people behind this who are entering in that information, and mistakes can happen, and you shouldn't have to pay for that.
Thank you. Another question, who or where can college graduates turn for help with refinancing of loans if they are not currently working and their income is based only on SSDI?
Okay, I can handle that one. It's actually, I'm going through that with my daughter, who has some student loan debt. Obviously, she just graduated college a few years ago. And it's very difficult to find someone that's going to take on a student, especially if they're not working. The key is to show some of your income. But SoFi has been great. Your local credit union is probably a good place to start. I know you don't think about credit unions when we talk finances, but that actually was the best rate that Jess went through to consolidate all her loans. And it's just a matter of, you do have income through SSDI, and, depending on how much your debt is and how much, what you have to spend on that, there are options. It's very difficult. I'm not going to say it's easy. It's very difficult unless you could show, relative income. But there's ways I can teach you how to make some money. So if you want to reach out, I'll try to help you as best I can. But other than the banks, the credit unions, or Creditable's a good one. SoFi is a good one. But we actually got our best rate through a local credit union that we didn't even belong to, that we joined specifically just so she could refinance the loans.
Thank you. And Ralph, I think this one is also for you. In terms of a credit rating, is there one component that is most important, total debt, credit card debt, salary, mortgage debt, etc.?
Well, debt, usually with credit ratings, debt to income is a very important one, but paying on time is your most important one. As long as you're not delinquent, as long as you're paying minimums or, anything that you're not getting into collections. Anytime you hit a collections, even if it's with a medical bill, it does take a little, with medical bills, it takes a little while for it to hit your credit report. But, once you hit collections, then you're not at the point where you could just pay the $20 a month like Danielle was saying. So the key is just to pay on time. And when you if it's a medical issue and it's a medical bill, I do a lot of it online, I'll go online and they'll tell me what my bill is, and they'll say, we'll accept 3 payments. And I'll be like, no, that's not how I'm going to pay it. So I just call them up. I'm like, I can't afford 3 payments. I'm going to do $20 a month, and I have it auto drafted. So it's $20 a month. It's never late. And they're happy with that. And there's no interest charges or anything like that. So it's just a matter of getting on the phone and talking to someone.
Good, thank you.
Yeah, there's good ways to monitor your credit. Just most of the credit card companies let you monitor it, but Credit Karma is a good one. But debt to income and paying everything on time is your key.